Welcome to your SNOMED CT Expo Day 1 Spotlight. I hope you're enjoying the start of this year's Expo experience. You're joined by over 1,500 delegates from over 60 countries around the world. Today's program has already kicked off with 27 concurrent sessions across our implementation, outcomes, and terminology-focused streams. The rest of today's concurrent session program will conclude with another 8 presentations from a distinguished set of speakers covering clinical decision support, genomics, and machine learning themes related to SNOMED CT. Please also take in our e-poster room, which hosts 18 posters available for viewing. The first of 4 tutorials also kicked off today with the introduction to SNOMED CT. Now, typically made available in English only, this year we're pleased to offer this introductory material in French, German, and Spanish. Also featured later today is the topical tutorial, SNOMED in the EHR. Day 1 continues with our first plenary session. Made possible by our sponsor, West Coast Informatics, we are pleased to bring you an informative session on semantic interoperability in the health data space, delivered by European Commission Director, Dr. Andrzej Ryś. We also have a new addition to our keynote program sponsored by MIMS, and it's one that will mark the day of 1 for some and the start of day 2 for others. Featured keynote speaker Dr. David Hansen from the Australian eHealth Research Centre will explore artificial intelligence technology and how it enables the future of healthcare. Today's program also offers a conversation with AMA and SNOMED International, where the discussion of the relationship between SNOMED CT and the AMA's current procedural terminology, or CPT, will be explored. As you take in the sessions, please familiarize yourself with what the Expo platform offers in terms of engagement opportunities. Reach out with others using the Meeting Hub, visit our sponsors and exhibitors in the exhibition hall, and use the live Q&A in your AirTouch device to pose questions to presenters in the sessions that you attend. Thank you again for attending the Expo, and I look forward to seeing you tomorrow. I'd now like to hand things over to our opening keynote sponsor, West Coast Informatics, represented by Brian Carlsson. Brian, over to you.
Thank you, Kelly. Hello, I'm Brian Carlsson from West Coast Informatics, maybe a little better known as WCI. We're proud to be here to introduce the keynote speaker for the 2021 SNOMED Virtual Expo. The employees of our company have been involved with SNOMED International since nearly its inception. We did earlier work in our careers with founding organizations like the College of American Pathologists and the National Library of Medicine, which is the SNOMED Relay Center for the United States. We were drawn to SNOMED for a variety of reasons. The member nation organization of SNOMED International positions itself well to be a major factor in national healthcare standards and the best bet to be the global language of health. The ontological nature of the terminology, and specifically things like the machine-readable concept model and the post-coordination mechanisms, provide a level of rigor that lets SNOMED be used effectively in a wide variety of contexts, like natural language processing and automatic coding of free text. Additionally, the extensibility mechanisms baked into SNOMED provide opportunities to pilot and test new content, and then make suggestions for improvements to the terminology itself. These are things that have been proved invaluable in our work. In fact, every time we work with a customer who's making terminology choices, often considering something like ICD-10, we make a strong recommendation that they adopt SNOMED first and work from there. Along our journey, WCI has provided consulting services and delivered software systems in the healthcare informatics space for many different types of stakeholders, including nonprofit standards development organizations, national governments, public and private healthcare providers, and to the still emerging digital health private sector. We've had 2 main taglines over the years since we got our start in late 2012. The first one was turning data into knowledge, which seemed to fit the moment. But ultimately, we thought this was a little too high-minded. What is knowledge to a computer anyway? And we felt like it had just become an overused trope in the healthcare informatics industry. We decided to change that and went with making data useful. The idea that rather than striving to have machines perfectly represent healthcare meanings in all situations, we would focus on ensuring that SNOMED and other healthcare terminologies could be used by actual implementations and solve real-world problems, like improving patient access to data, providing better insights and analysis of outcomes in real healthcare scenarios, and interoperating more effectively between systems that talk terminology in different ways, such as clinical and research systems. Our primary focus as a company has evolved. We're now working to democratize access to and use of healthcare terminologies across the industry. Maybe going forward, our tagline should become making data accessible. We want to enable as many stakeholders in the global healthcare system as possible to obtain and effectively use healthcare terminologies. This means things like frictionless access to APIs and terminology browsers that are preloaded with relevant content, touchless management of update cycles and release schedules, integration with licensing systems to manage proprietary content access, and the ability to do things like build custom code sets, map terminologies, build value sets, and perform a similar range of other related tasks. As part of this effort, we're also developing educational resources for a range of users, from novices who've just heard about terminology, but don't know which ones are available, what they're for, what content areas they cover, or whether they achieve compliance with their own national standards, all the way up to sophisticated users of complex ontologies like SNOMED to help understand things like how to use post-coordination in conjunction with concept models to scan text and build novel but legal meanings in SNOMED, and then share those things downstream to vendor systems. We're grateful to have been a part of this wonderful community, and we'll continue to do our part to ensure SNOMED achieves its full potential. As the sponsor of today's opening plenary, WCI is pleased to introduce our distinguished keynote speaker, Dr. Andrzej Ryś. Dr. Ryś is a medical doctor specializing in radiology and public health. In 1991, he founded the School of Public Health at the Jagiellonian University, where he served as director until 1997. From there, Dr. Ryś served as director of the Krakow City Health Department. Between 1999 and 2002, he continued his career as Poland's Deputy Minister of Health, where he was a member of the Polish EU accession negotiators team for the harmonization of the Polish healthcare law with the EU's acquis communautaire. After becoming Senior Health and Management Limited for the World Bank and EAR in Serbia, Dr. Ryś founded the Center for Innovation, Technology Transfer, and University Development at the Jagiellonian University, where he was director until 2006. At that time, he became Director for Public Health and Risk Assessment at the Directorate-General for Health and Consumers within the European Commission. From 2011 to 2014, he assumed the position of Director for Health Systems and Products, and since 2014, Dr. Ryś has served as the Director responsible for health systems, medical products, and innovation in the Directorate-General for Health and Food Safety at the European Commission. In preparing for this session, I watched a number of presentations by Dr. Ryś that Dr. Ryś gave on strengthening primary care and building resilient health systems. One theme that jumped out at me is the essential need for coordination between primary care, outpatient, and hospital systems, along with social care organizations. When these systems work better together, they also just work better. And as I see it, SNOMED has a large role in facilitating a key aspect of that coordination, data sharing across organizational lines. With that, please join me in welcoming Dr. Andrzej Ryś.
Dear ladies and gentlemen, let me address a few words from DG Santé, Department of Health and Safety from European Commission, Brussels. What we learned from COVID pandemic, that it was highlighted the importance of citizens be able to access and share their health data in the digital format with health professionals or other entities of their choice. It was a case of test results, vaccination certificate, also basic health information needed, for example, for the consultation with primary health doctors. As a part of the creation of European health data space, the Commission is working on providing access to and use of health data for healthcare, for health research and health policy making, but also for the regulatory purpose, like, for example, pharmacovigilance. Free movement of digital health services and product is also part of this initiative. There is currently a fragmentation of standards used to express clinical concepts. This hampers the semantic interoperability of health data and undermines the European health data space for reaching its full potential in next years. The SNOMED CT community of practice is growing, with the new countries joining. The European Commission, through the EU Health Programme, will support EU member states that wish to implement SNOMED by funding 60% of the costs regarding the membership fees for a period of 5 years. At the same time, I think it's also good to realize and reflect that in one hand, the current SNOMED International Membership fees work as a fundamental resource to maintain and evolve SNOMED CT, while in other hand, they work as a barrier for countries with big populations due to the fact how fees are calculated. In the desired world of building an open standard, it is important to reflect and take care about the interplay between SNOMED CT and ICD-11 from WHO. There is a need to provide clinicians with a terminology to consistently represent clinical content in a way that enable future use for health, policy making and regulatory activities, research and innovation. The Commission is currently working on legislative proposal on health data space, which intend adoption around beginning of 2022. It is complementing the Data Governance Act proposed by the Commission last year. This legislative proposal will be structured around 4 pillars: sharing, access and control of patients over their data for healthcare, use of data for research and policy making, single market for digital health services and product, and support development and deployment of AI in health. By 2025, we aim to facilitate citizens from all member states of EU to be able to access and share their health data. For example, patient summaries and prescriptions with healthcare professionals of their choice when traveling abroad through so-called myhealth.eu infrastructure. The Commission also acknowledged the value of SNOMED CT and argues for capacity building initiatives. In particular, initiatives to widespread successful implementation of SNOMED CT with meaningful impact of patients' journey. This is important to use the good practice sharing model, which we believe it's worked. It may help different implementators from member states to connect the dots, learn from others, and kind of improve the projects they are starting in all member states. We also encourage the SNOMED community to innovate by opening itself so that a bigger number of health professionals, citizens, and patients across the world can benefit from this core terminology. We are ready also to work together on new initiatives. For example, we are implementing now quite important nomenclature for medical devices, which is a very important part of European approach, but we hope can be shared widely internationally. The European Commission also looks forward for the exciting innovations ahead stemming from European health data space, fueled by the power of open standards. So I wish you very good meeting And thank you very much for the opportunity to speak to you today. Goodbye.
Okay, so welcome everyone to the final part of the session. The final part will take basically a panel discussion following on from the keynote speech that you've just listened to. The work with the EU marks a fundamental shift in some ways in the work that we've been doing within SNOMED and with European countries up to this point. But certainly having the European Commission, having support from the Commission going forwards is an important development, and one which I think would benefit from some exploration. So on the panel today, we're joined by 4 esteemed colleagues. We have Ioana Gligor, who's from the European Commission. We'll keep ladies first. So Stefanie Weber, who's from BfArM, the German National Release Center. Daniel Carlsson, who is from the Swedish National Release Center. And last but not least, well, in fact, not last but one, is Stefan Sabutsch from the Austrian National Release Center. And finally, but not least, is Pim Volkert, who's from NICTIS, which is the Netherlands National Release Center. So I have a number of questions which I'm going to pose to the panel. So the first one, we'll keep it quite high level, I suppose, in some ways. So can you offer some initial thoughts on the EU SNOMED initiative that's been shared by Dr. Ryś, particularly around funding, I guess? So we'll start with ladies first. So I think we'll start with Stefanie first on that one.
Thank you very much, Pim, for the question. Thanks for the possibility to discuss this important initiative on the panel here. For us in Germany, as we have just joined the SNOMED community this year, it's a very exciting movement that the EU is now investing in the possibility to use SNOMED CT throughout Europe. So for us, our aim to make it possible for German citizens to have cross-border healthcare throughout Europe and to take their data along in a standardized way will hopefully benefit from this initiative. So we're very excited to see that this is coming at the same time as we have been joining the SNOMED community. So we thank the Commission for this possibility.
And to you, I think, Daniel, next, if that's okay.
That is okay. First, thanks to the Commission for providing this opportunity. Of course, my first reaction is, of course, who will join and what will the impact be of this, but we'll know soon enough. So, interesting future.
Indeed. Ioana, do you want to comment from the European Commission's perspective?
Yes, thank you very much. So indeed, as you know, we are going to support the coverage partly actually 60% of the licensing for the SNOMED CT for the license. However, this is only the beginning of the effort, because there is a lot of effort behind of supporting the implementation of SNOMED CT nationally, and this is clearly something where the member states have the highest role. And then there is the second element, which is extremely important, and where the colleagues present here, Stefanie, Pim, and Daniel in the Semantic subgroup are supporting, is the use of the different coding systems, terminologies, etc., standards and specifications, including SNOMED, to ensure interoperability. And one element that I would like to underline, for instance, it is the the efforts that the semantic subgroup have been doing over the last years in having a new release of the patient summary with clear indication on the coding, on the preferred coding for different aspects, as SNOMED CT is one of the preferred coding in a lot of cases. There is also the effort of standardization for the EU digital COVID certificate, and there again there is a lot of reference to the SNOMED CT. So indeed, I mean, we are trying to tackle this from several angles, financial support, but also coordination, governance and coordination at among the member states in order to ensure interoperability and to implement this in practice. And I think your support, for instance, for training, for implementation, etc., would be of extreme help for the member states to help them implement and trickle down at hospital level, at the lower level, at basically the ground field, this effort, and to produce results. Because otherwise, if we are just speaking about a license which is being paid but is not being the coding system is not being implemented, then the effects are not necessarily there. Thanks.
Thank you. Stefan, from Austria's perspective?
Yes, thank you for the invitation to this panel, Ian. Thank you very much. Austria is a relatively new member of SNOMED. We joined 2019. And if we were not already a member, this initiative would have the final push to become a member. So we think that the initiative of the EU is great, and I hope it will give more momentum to the implementation of SNOMED. And I think it will speed up the implementation of the patient summary, for instance.
Thank you. And finally, but not least, Pim.
Yes, thank you, Ian. Well, for the Netherlands, we are now fortunate to have all our neighbors having a SNOMED license. Germany is implementing SNOMED on a fast pace. And so we can exchange information across the border, probably much more faster, easier as well, also with Belgium. And I hope that all other countries soon might say, yeah, our neighbor also has a SNOMED license, and we can exchange information in a more fluent way and semantic interoperable. But that's our aim, to get healthcare information across borders, but also in a country. And the more countries which will use SNOMED, the better it is also for us. In the Netherlands, we are one of the founding fathers of SNOMED. But the more data we have in Europe, or in the world, in fact, on healthcare, the better decision-making we can have by healthcare providers. So I'm very happy with this initiative.
Thank you. So one of the key topics in Dr. Rys's presentation was around interoperability. So based on your own country's interoperability goals, how do you think that the work within your own country will be impacted by the EU initiative? And that goes to Daniel first.
Okay, thank you. Sweden is also one of the early countries to join the SNOMED International Organization, IHTSDO at the time. But we're still working on implementation. So implementing a standard terminology it doesn't implement itself. It's a shift from a largely free text-based documentation, healthcare documentation tradition to a more structured, and that requires what Ioana described so beautifully, that this needs to trickle down to the hospital level, or maybe it should grow up. I don't know. So we have, as has been mentioned, our Nordic colleagues also now all being SNOMED members, and that has in some specific areas opened up for cross-country collaboration. And we have a Nordic, see it in English here, council, which also has an e-health initiative, and some of the Nordic countries are EU members, but all of them are EES members, so they're still participating in this joint work. Thank you.
Thank you. And we'll go to Stefan next, I think.
Okay, I believe that that our work will not significantly be accelerated. We are still in the process of laying the foundations for a structured exchange of diagnostic data, especially in physician reports. But we have already come a long way with laboratory findings, but we are using LOINC here in this area for more than 10 years. So.
Okay, thank you. Pim?
Yeah, I think interoperability, semantic interoperability is not easy. And it has not so much to do with SNOMED as much as you have to standardize your content. But it's a steep learning curve, and it takes a lot of effort. And everybody's doing a bit here and a bit there. But using SNOMED, you can go wider. Yes, of course, you have LOINC for laboratories, but all the other domains can be covered by SNOMED, which helps enormously in learning how to standardize content and how to make use of standardized data and reuse it. And that's something I really hope that we can do also in Europe, learn from each other how do we reuse this kind of clinical data and make smart software, for example. But in the Netherlands, we are progressing pretty well with interoperability. Semantic operability is lagging a little bit behind, but we're catching up with SNOMED and the other standards.
And Stephanie.
So how will this impact the German strategy? So as I said before, we're pretty new in the SNOMED community. And as you might know, we have had lots of legislation in the past few years on how to become more digitalized in the health system, how to reach better standardization of data, how to introduce electronic patient record for each citizen in Germany, and so on. So there's lots of initiatives ongoing right now. And in the becoming a member of SNOMED CT process, we did learn a lot from our neighbors and from some countries here, or actually all countries here on the panel, that from their experiences, we could benefit and have a good approach. And I think with this European initiative, there are a couple more countries now onboarding, and it will help, I think, capacity building within Europe on how to approach this, how to implement this. And by pushing forward the patient summary, for example, we all together can learn where are the hurdles, where are the problems, where do we not suffice with the code systems that we have yet, and where do we need to reach compromises so that with the implementation in Europe, we really can start to communicate even cross-border. And this, of course, would serve for us in Germany as kind of an example or a good experience to help us move our strategy on interoperability forward. So I think going with so many countries in different states of interoperability and SNOMED CT implementation into the next 5 years, countries can learn from each other, and even the countries that have long implemented SNOMED CT might learn from the newbies a little bit on new techniques that they might use, and even might change their strategies. So I think with so many countries in the European approaching this now together, hopefully capacity building will be a important benefit for us in Germany throughout this process.
Thank you. So I suppose moving on a bit, we've talked, and Dr. Ryś talked about the initiative being a key step in European-wide interoperability. And I wonder if you can expand on that, about what I suppose the practical steps in some ways, what the practical steps that we need to take to achieve European interoperability. Ioana, do you want to comment on that first?
Thank you very much. I would maybe like to build upon what Stefanie said. We are preparing now a program of capacity building among the member states to support the development of their e-health strategies, including semantic, including interoperability aspects, etc. And indeed, probably the semantic interoperability should be really one of the main elements, with the aim of supporting to learn from each other in these aspects. So this is one thing that I also noted that, and also already wrote to my colleagues, that one of the top priorities for the capacity building should clearly be built upon the semantic aspects, and probably we need to see also together with you how we can join forces in order to make the best use also of the resources that you are offering in the context of the SNOMED. Coming back to your question related to interoperability, indeed, the member states in the e-health network have been focused on these aspects for quite a long time. I think there is already the interoperability framework which has been developed, and the semantic interoperability is one of the aspects, and basically supporting the licenses for SNOMED. It's part of the strategy for ensuring or supporting semantic interoperability, and also the work of the subgroup on semantic, and also the technical subgroup of the e-health network, and the whole work of the e-health network so far has been going into the direction of interoperability. Let's not also forget that MyHealth@EU, which supports the sharing of patients' data in the cross-border context with the healthcare professional in the country of destination, in the language of the country of destination, also it's a way of implementing this interoperability and giving it a practical meaning for the individuals and for the citizens. Again, I think basically the fundamental role of semantic interoperability of basically of terminologies, it's clearly underlined also in that context. Without a proper basically a proper coding, without a proper clinical terminology, which is being implemented at healthcare provider level, such translation in a continent which has a multitude of languages would be very complicated, and could also basically create a lot of unwanted effects. I mean, for instance, if a doctor in Greece doesn't manage necessarily to understand the patient record of I don't know, Bulgarian or other patient, this can also have very, very serious consequences. So I think basically having the right terminology, having the right support in this area, it's not just something which is done for the sake of speaking about interoperability, for the sake of speaking about between experts, but it has fundamental consequences on the life of people and can make the difference between life and death sometimes. So I think bearing this in our mind can also give another perspective to the technical work which is being carried out so successfully in the semantic and in the e-health network.
Thank you. Stefan.
Hearing all that you said, what comes to my mind is that an excellent promotion for the implementing of SNOMED would be the support of translation. It's still one of our biggest obstacles for the implementation. Together with Switzerland, Germany, and Luxembourg, we have already established a very good basis for our cooperation. But at the current speed, we will need several more years for the translation. So, and I don't think we can implement SNOMED in English all over the country.
Okay, thank you. Pim.
Perhaps I can add to what Stefan is saying. So, translating is really an issue. It's a cost. Again, it's not really SNOMED related, but if you want standardized content based on an international standard, we have to translate. So that you always have to do that. And I support Stefan's idea or saying that we should help each other there too, looking for good tooling to translate, in this case SNOMED, so that we can exchange information, because it needs to be in the local language. I saw also a question in Q&A, can it be English? Yeah, of course, all international standards have English as the base layer, so you can exchange that. But we work in national languages, and several countries have different languages within a country. SNOMED can support it, but you have to translate. We even go as far as have patient-friendly terms, which it's another level. It can all be supported, and it helps it exchanging information within your country or between countries. But I'm not sure if I answered your question, Ian, because we deviated a bit from the subject, I'm afraid.
You use your presenter's free choice, I think, on that one.
Okay.
So, Stephanie, over to you.
So, yeah, having lost a little bit the question that you asked, but continuing on the introduction by Ioana, which I think was very important, and the comments right now, I think for us, moving this forward, we need to acknowledge as well, which has already been said, there are other code systems there as well, which due to legacy or to use case, we need to support. One key code system, of course, is the ICD-11 that is looming over all countries in Europe, and we will have to report at some point data in ICD-11 to WHO, probably to OECD. So we cannot think about implementing SNOMED alone and thinking that this is the only solution, but we need to fit SNOMED in the let's say, the suite of code systems that we need to employ. There are other European code systems, like Dr. Ryś said, like the EMDN, the medical device nomenclature. There is lots of nomenclature around pharmaceutical products at EMA for regulatory purpose and so on. And we hope that SNOMED CT can serve a little bit of a bridge between systems that we can't really bring fully together. So I think if we implement SNOMED in this suite of code systems here, a European initiative would be very helpful, because the problem is the same for all countries. It's ICD-11 is a problem for every European countries that still uses ICD-10 or earlier versions. Here, SNOMED could help bridge code to the new version and so on. So that would be something that I think in the next 5 years or so, we do have to discuss together on how to make use of this, so that the whole system, the whole environment in which we put our data is then really fully interoperable, and that we still do not put extra burden on the people who are capturing the data that then would have to serve 2 code systems or so. We definitely want to avoid this for Germany. We want to have the people entering the data into the system use simple and easy to use platform. So we need to think about how to make all these under the hood structures and semantic interoperability easy and compatible. So that's, I think, an important part to not forget. And I agree, just implementing SNOMED does not solve the full problem. So we have to work on this together. But again, here, the European force with many countries joining this, hopefully will make it easier for each single country to approach this. Thank you.
Thank you. And Daniel.
Oh, yes, I have lots of stuff not jotted down here. So first, I would like to mention one thing that we didn't say on the last item about the impact, and that is that the that the Commission has made this this offer, made this decision, actually is a signal to any who would be doubting the use of SNOMED even on the national level. So it is actually quite we were talking, and I was talking a lot about the problems, but this is a great opportunity, I think. So I think that's important. Going back to the question about how this has an impact on EU interoperability, I think I'm very happy now, as you can see, having worked on the SSCT project a few years ago, and now seeing some of the recommendations being implemented. As Stefanie said, we will need an ecosystem of terminologies, but we see that, just like SSCT, that SNOMED might fill the role of a reference here. I think it's also a realization that a terminology, not a terminology, an ecosystem of terminologies is needed for interoperability, and interoperability is needed for high quality patient care, as Ioana was mentioning before. I think there are a number of EU activities which will be where this decision might have an impact. So one is guideline development. Which is happening through the health network. So having this decision to lean on might facilitate that work. There are a number of EU projects. The European Health Data Space could benefit from the ability to rely on a certain terminology. Cross eHealth is another project where the need for a standardized terminology is huge. So I think this has a potential to have a huge impact on EU interoperability. Thanks.
Okay, thank you, Daniel. So we'll move on to one of the questions from the audience, which I think is quite pertinent in some ways. So we've talked about open standards for health data, but in reality, a lot of the big vendors remain closed and really have no reason, financial or other, actually, to share their data. Should the EU take a position where it looks at enforcing standards, either through enforcement or through financial support, to actually get vendors to, I'll say, play the game? Ioana, do you want to comment on that one?
Well, Daniel was mentioning the European Health Data Space, and indeed the Commission will adopt a legal proposal in the first part of 2022, and this will cover two aspects: the use of data for healthcare, so everything which is now basically known in the context of the eHealth network, My Health at EU, the possibility for people to share their health data with and to basically to ensure the access and transmission of their health data. And the second part, it is related to the reuse of health data for research, policy making, and regulatory purposes. In this respect, we are aiming to build upon the provisions of the GDPR, which already allow for the access and portability of health data. However, between healthcare providers and cross-border. However, what was also missing was also in the context of the GDPR, it's a little bit the how to do that, how to implement this in practice. So this is what we are going to try to address through the European Health Data Space. I don't want to prejudge the outcome of the legal proposal, because we are just in the part related to the impact assessment, and there is still a long way to to go, and then there are very complex negotiations with the member states and with the parliament. So again, I don't want to prejudge, but clearly one of the elements which is already there is the fact that the people can have access to their health data and can also ensure the portability of their data, including health data. And of course, this also means basically the more open standards. In the EU, we have been trying to do that in the context of My Health at EU and also in the context of EU digital certificates and other projects by, first of all, looking at open standards, try to really to build upon open standards as much as possible, and also trying from the Commission perspective to develop open standards reference implementations that could be provided to the member states and then further developed and built upon at national level. So I know that the question that has been raised, it's a complex one, and I don't have a quick and ready-made answer. I think it will depend on a lot of elements, but I think basically the long-term objective is indeed to support interoperability and to try to build our work on common open standards, and the work that has been done by the Semantic subgroup and by the eHealth network, it's going into that direction.
Okay, thank you. Pim, do you want to comment on that from a national perspective?
Yeah, national, but also in international perspective. So it's the carrot and the stick. You can say that all the vendors have to be able to exchange data in the patient summary format, with the structures and the coding systems which are included there. And you can think about the carrot that you say, well, you subsidize the vendors to move over to it. But there's also another carrot which I would like to emphasize, especially if you work with SNOMED. You can see SNOMED as a simple coding system, like ICD-10. Nothing wrong with ICD-10, but it's a sort of one layered system. But it can also be used in a sort of more a knowledge system. And I think one day or another, vendors will discover that they can use SNOMED to their own benefit, creating a better information system. And even with this European Union initiative, some countries who might be sort of lagging behind now in information exchange, if they entered the SNOMED world and they start new, they might jump into the more smart solutions of software. A lot of intelligent software vendors out here in Europe, and if they make really use of what SNOMED has inside, and I think today we saw already a lot of examples in the Expo, that's a big carrot for a vendor. But traditional vendors will have a little bit more difficult to move over to such a way of viewing to data.
Thank you. Stephanie.
Yeah, so I think the question if the EU should enforce certain steps, key one. I think personally, my opinion is that it's not helpful to enforce, but it would be very helpful to kind of show the benefit of a system. By having such a heterogeneity in Europe, we can see which don't, where the benefits are, where things do not work so well. And what we did with the patient summary guide, tried to reach consensus on what would be the best way, noting that in some places we could not fully reach consensus yet, but we redeveloped this document in terms of like a lighthouse where countries that reorganized their semantic strategy could orient on and move towards. I think changing in interoperability is nothing that you change from one day to the other. It's a long process, and it takes a couple of years till everybody reaches the same direction. Enforcing would really raise, I think, objections from countries to, because there might be reasons in countries why there is no move, that there might be reasons within software companies where they're not able to move at a certain point because of customer needs. I think enforcing from the EU would not raise the excitement of countries to move along on this journey of defining the semantics for Europe. So my personal opinion would be that it's not really helpful, even though, of course, setting a standard would push everybody in the same direction, but then you would not learn from other possibilities and other options so well. So I think it has pros and cons. Thank you.
Thank you. Daniel.
On the vendor topic, is always still, okay. I think I agree with what's being said. I think that we've seen from national experiences that once you have a system of to support interoperability in place, the vendors would they would want to have their systems being interoperable with whatever framework is around, to ensure that they're still relevant on the market. I also think that the psychology of like enforcing things by law and so might not be helpful in this particular topic.
Thank you. And Stefan.
Well, I think it would be important for the Commission to take a position like you mentioned initially. It's our experience that all large-scale changes to the IT landscape in medicine are incredibly slow, especially in Austria with our fragmented landscape of vendors. And the same is true to change the interface terminologies. It is a very painful experience with our national patient record, ELGA, that the vendors will require financial reimbursements for all the changes needed. And I believe that the manufacturers to have no intrinsic motivation to implement semantic interoperability. So I think we need strong incentives to change the systems to be able to share the data interoperability.
Thank you. And then picking up on one of the other questions from the audience, one of the key benefits of SNOMED is obviously interoperability. The other is SNOMED's support for analytics. So how might the Commission go about achieving the maximum benefits from the analytics side of SNOMED? I'm going to go to you first, Pim, and give the others time to think, because I know you'll have an opinion.
Sorry, question was sorry, Ian.
So literally, what could the Commission do to maximize the benefits of the analytics side of SNOMED?
Yeah, first appreciate the value of it. I think that because a lot of people think SNOMED is only for interoperability, but they don't know that the greatest, I think, value probably is in analytics. If you have clinical data, what can you do with it? Of course, there's TDIS going on in Europe. There's a lot of research projects going on. So I hope the knowledge of SNOMED will trickle down also into those projects and will be reused. And having said that, so we need an overarching strategy for clinical data, capturing clinical data, exchanging clinical data, and research on clinical data. And the subgroup on semantics is, I think, in a position of helping to advise the Commission on what to do to get such an overarching strategy on clinical data, and thus also the clinical data standards, which needs to be in place.
Stephanie will go to next.
Yeah, I'm afraid as we are still very new community, I'm not reporting on many results yet in analytics with SNOMED CT data. I think for us, of course, an important step would be, and for all the countries that are coming new now, would be to have some data that you can show the analytics benefit to your country and to Europe. So if that could be shown in the European project, like the one that Pim just mentioned, the TEDAS, or following projects on that, or in projects where the more advanced countries who already do have data fully coded in SNOMED on specific use cases that are of high importance to Europe can show what can be done with SNOMED data, that would help the countries that are joining new, like us, to learn more and to see where we can even reach additional benefit once we have SNOMED used in our system more thoroughly.
I guess, Ioana, does the Commission have a view on the analytics side?
Indeed, I mean, one of the projects that we are supporting is the joint action TEDAS towards the European health data space, which is looking on the secondary use of health data for research policy making and regulatory purposes, which is the second pillar of the European health data space. And clearly, in that context, the work which is being carried out on the data quality will also look into the advantages offered by clinical terminologies like SNOMED in supporting this work. And as we will advance with the European health data space, both in terms of data quality aspects, but also in terms of infrastructures, I am sure that basically this added value will become even more apparent, and this type of collaboration will be able to extract more benefits from this.
And Daniel, I think, will be the final one because we're almost out of time.
Okay, so thank you. I think much has been said. I think you could look at other projects that have benefited from the use of SNOMED for analytics. And I'm thinking of, for example, Open Safely, which we've seen reported at this meeting and previous year's meeting, and the COVID work that they have been doing. Odyssey is another large-scale project where they are benefiting from the use of the analytic aspects of SNOMED. I think there is much to learn from other projects' experiences here. And of course, the TEDAS project, the European Health Data Space, will start work on semantic interoperability as a data quality aspect. I think soon to start. So that will be a very interesting discussion.
Okay, thank you. So we're almost out of time. So I would like to thank all the panelists. Hopefully you, as members of the audience, have found it interesting and stimulating. And I'd like to bring this session to a close. So thanks again, and hopefully you'll enjoy the rest of the Expo. Thank you. Thank you all.
Thank you.
Thank you.